It's really, if you look at life sciences, it's the number one growth segment for big data analytics across all industries. Bioinformatics services are the fastest growing segment, and academics have the highest growth potential with 38% CAGR. And interestingly, right now, in terms of applications, genomics is by and far the lead application, of course. But as we start to move downstream in the analytics pipeline, you're starting to see like chemoinformatics, which is the use of informatics to understand, target, identify potential druggable compounds, look for drug toxicity, pharmacogenomics and whatnot. That's going to take the lead, earning $2.8 billion by 2020. Throughout this time period, medical bioinformatics will have the highest revenue, approximately $4 billion by 2020. What you've seen is with the advances of the next-gen sequencing technologies, there's been a huge shift. All this time we've been talking about achieving the $1,000 genome. I think we finally achieved that last year after more than a decade in the making. And so previously all of the emphasis was really around trying to get much more optimal performance and shrink the costs in the sequencing process and the chemistry and sample preparation. Now that we've kind of cleared that initial hurdle, and really we talk all the time about how the fact that that's proceeding much faster than Moore's law. Now what you're seeing is a huge shift in both the data output of these instruments, and then the challenge is really moving to how do we deal with downstream analysis. And that's really a lot of the focus of today's symposium with you, is to really understand what kind of pressure is that putting on both research and clinical operations alike. And then this affects both the institutions that are managing large production pipelines, as well as smaller institutions that are just starting to gear up towards doing more applications of genomics. So molecular medicine is really truly a big data problem. It's interesting, the day when every newborn gets her DNA sequenced at birth is not far off. So these are just two thought experiments, if you will. If we gradually increased the point where we were able to sequence all of the U.S. population, that would equate to something like 300 exabytes. And if you think, perhaps more importantly, it's not just enough to sequence somebody once in their lifetime, but ideally you would sequence multiple times during the course of treatment. So, another hypothetical example would be if you were going to sequence every cancer patient in the U.S., let's say every 2 weeks, that would become, close to 500 exabytes. And that's really just the raw data. If you start to factor in experimental design, again, significant downstream analysis, you start to include drug response data and certainly images, which is supposed to be something like 10x the size of genomics data today. Molecular imaging will be. That's going to push it even farther up in terms of the closer to the orange line. So those are just two examples of why the data output from these new sequencing systems are such a huge impact on the industry as a whole. The new systems that were released last year are something like 4 times the data in 50% less time. So it has a significant impact. So now we'll touch upon some of the additional technical trends with all of this. We've talked a little bit about the implications of the high throughput instruments. There's also obviously a huge burden of data management. How do you store and manage and move around petabytes of research and clinical data? And many of our customers are really struggling with, they have the need for clinical trials, for regulatory purposes. They need to reliably snapshot those pipelines and archive them to tiered storage. Use policy management to move them between different hierarchical storage systems. And in many cases, the science is really rapidly changing. There are discoveries that are being published every day, and the scientific algorithms are changing. Typically every 6 months. It far outpaces what IT can keep up with. So it requires tremendous flexibility and agility on the IT and HPC infrastructure departments. Importantly, this segment of life sciences really relies extensively on open source applications, and most of these applications were developed really to develop the science. They weren't focusing on performance, right? So most applications do not fully leverage the available infrastructure, and that's increasingly a challenge as you start to scale up workloads to keep up with these analytics.